Perfect. So on today's seminar, I wanted to share updates with the project that is associated with Software Center. That's done together with Ericsson and Sahlgrenska University Hospital, and it's about the anomaly detection in radio networks and critically ill patients. So, without further ado, what's the real challenge here that I experience while we have this project? So, if we look at those two environments, the critically ill patients and radio networks, they are both similar, but also very different. I mean, they are similar in the extent that there is a lot of signal processing work that is done in those areas. So a lot of work that is related to research is about processing the signals, being that from patients in the operating room or being that from the radio networks. They are still signals. And then there are also similarities in terms of what we are really looking for in that data. So one thing that we are looking for is the anomalies, and the anomalies are defined a bit differently in those two different areas, but they have one thing in common, that they are essentially very rare or very seldom events that we use in both cases. Then also we could use the same methods, but they work very differently for both of these areas. And I will show you in the outline today, in the talk today, why this is so, and which areas work better and which work less good. And then we have patient-generated data and computer-generated data, which are very difficult. I mean, computer-generated data is computer-generated data. It's very repeatable and it should be very uniform. It's not always the case, but it's much more uniform than data collected from patients who are human beings and of course have very different characteristics, individual characteristics. So I will show a lot of examples of anomaly and rare event detection in our study throughout the presentation. Now, in past sprints, we have actually looked into the definition. What is an anomaly? What is it actually? And we have done a study together with colleagues Jennifer and Wilhelm on radio networks, and we have actually found that even in the context of computer-generated anomalies, the number of anomalies and the kinds of anomalies are it's quite large scope. So there's a lot of those types of anomalies and a lot of different type of anomalies. And there is, of course, different even definitions of anomalies, because as long as we have data, we probably have anomalies that are related to things like noise, things that don't work in the data. We just have noisy environments. We could have extreme data points. We could have, for example, broken sensors of some sorts that will give us erroneous readings, and we have extreme values of that. And we have, of course, unexpected data points, things that should not happen in the data, but they actually do. And we are, of course, interested in all kinds of anomalies, not only as an anomaly, but also on what kind of anomaly that actually is. So if we look at the typical method for anomaly detection and classification, of course, we can ask people about how they identify anomalies. And this is the kind of diagram that you see, which has been done based on interviews with practitioners. But we can also look at how the anomalies are really defined. And there are two approaches, two mainstream approaches. One is a rule-based. So we define certain type of criteria that has to be met in order to call something an anomaly. And those are two types of rule-based definitions. One is by contradiction, which is the most common, basically saying that this is not everything except for the normal data. And we can define how normal data can look like. And you have on the diagram, we can see a diagram of the strength of the signal of radio link, which is showing the drop in the signal strength due to rain density. And this is defined by contradiction. We have this formula on the right hand side, which defines how the attenuation should be. And then, of course, we can have a rain, and then that describes the anomaly, so to say. And we can also have a explicit specification when we don't talk about normal data, but we talk about the anomaly as what it actually is in the environment. We have a definition of that. For example, that in a consecutive 5 minutes, the number of the signal strength has to drop by 10% in order to be considered an anomaly. Then we also have methods that are related to machine learning. And there also we have two types. We have the explicit one, when we try to find a predefined pattern in data. For example, we are looking for the pattern like on this picture on the right-hand side, or we are looking for deviations from the normal pattern, basically like a contradiction, except that we are using machine learning without a predefined data. So that looks so far so good. Of course, it's a simplification, because in practice this looks something like this. So on the left hand side we have two different diagrams. We have a diagram which is heart rate variability from a healthy patient. It's the blue diagram at the top over here. This one, and as you see, there is a lot of variability in the heart rate, and that's because our hearts actually sometimes skip beats, and sometimes they are just irregular, and that's quite normal. However, there is also a different type of heartbeat. For example, when we have a stroke, our heart actually beats more consistently. It beats much faster. As you see, that the scale is a bit lower, so this is of about 50% faster. I mean, the heart rate variability means that how fast the heart beats. So the lower the value, the faster our heart beats, and that's quite normal, because if we get a stroke, then of course our heart tries to compensate for the loss of blood and then pumps more blood to the brain. So there's of course this pattern, but it's easy for us to see. It's very difficult for machine learning algorithm to actually discover. And I will show you a few of the challenges and how we tackle them. Now, if we also, for example, have a radio network on the right-hand side, this is a signal. It's a signal strength, and as you see, except for the spikes and the deviations and anomalies somewhere over here and the big spike at the beginning, this signal is quite consistent, and that's because it's for the first computer generated, so that it's generated very consistently, and it's also if there is no rain, for example, over here, then there is of course not so much disturbances in that particular link. But if there is rain, we see this kind of anomalies, like signal strength going down quite significantly, or when we have, for example, not only rain but also heavy rain that stays on the antenna for a while, then we have a lot of rain and then that dries out over a longer period of time, which of course we have defined over here as anomalies and standard signal. So it's not as easy, but it's not as easy to look at that in the reality as it is on the picture. Now, if we look at machine learning and actually identifying anomalies in anomaly detection algorithms, there is a few of those. So one is, for example, looking at the robust covariance, which is a very old algorithm and pretty good one, but I will show you that it's not always really working very well for us. One of the modern algorithms, on the other hand, is something that's called isolation forest, which can identify anomalies, data points, the blue ones outside of the pattern, in with quite good results. As you see, it's quite fitting quite complex shapes in between, which is something that we would expect to happen in our case, because we have quite a lot of variability in the data set. Now, if we look at how they actually work in our data set, so this picture is actually based on the auto-generated data from machine learning data set, so it's not that relevant for us. But if we look at data that is actually relevant for us, so how this actually looks. So here is a data from a link that's generated over a period of, I think, if I remember correctly, about a month. It's it's in the beginning of the year. So we see some anomalies that are quite long in time, which could be caused by, for example, a lot of snow lying on the antenna. And we have a short ones, which could be caused by rain on the antenna for a period of time, or even lengthy periods of time when we have a lot of frost on the antenna. And if we look at the anomaly detection algorithms, if we, for example, go for a rule-based, as I mentioned before, if we look at the papers describing anomalies, then basically the entire period would be classified as anomaly. That's the red line. If we go, that's the domain based. If we go for the rule based, defining an anomaly as something that is different from for example, a signal loss below a certain percent, then as you see, we get in a bit more interesting results. This period of time is actually not anomalous, but this one is actually an anomaly. And then there is another anomaly over here, and so on and so on. Now, the problem, of course, is that, as you see, some periods we would, as human beings, consider anomaly ourselves, for example, those two spikes. But in the algorithm, it actually recognizes them as two different anomalies. And even though a big anomaly at the beginning is recognized quite consistently as one big anomaly, it's not recognized very consistently in this period of time when the values are going up and down all the time. And if we go at this isolation, if we look at the isolation forest algorithm, which is the next one, the most modern one, the most machine learning one, then you see that the orange one is even more consistent. Even the big anomaly at the beginning of the period is actually identified as anomaly and non-anomaly during specific times. And that's because the isolation forest doesn't understand the domain. It doesn't understand what it's analyzing. It's only looking for outliers. So of course, if we look at, for example, this period of time, which is considered an anomaly over here, that is an anomaly because the signal strength goes down quite a lot. But then when it's a bit more consistent over here, it's not identified an anomaly anymore because it is more consistent towards itself, and so on and so on. So how do we work with that in practice, so to say? Well, one way is what we are doing in our project is that we have defined actually a pipeline which we use both for the patient data and for the microwave data, is that we are looking at, first of all, collecting the data and labeling that both manually and automatically. We have algorithms that are looking for anomalies and setting aside the data to understand the anomalies. For example, then we have, in many cases, a person, a human being, who is looking at those anomalies and trying to identify if they are really anomalies or not. Then we have algorithms that visualize how the anomalies and non-anomalies are actually spread over and different from other periods of patient's life, or other periods of signal transmission. And then we have the machine learning algorithms that actually try to understand those anomalies. And in many cases, the situation is, as you see on this confusion matrix, that we, in many cases, in some cases, we're very good in recognizing certain type of anomalies, but maybe sometimes we are not that good in recognizing 2 or 3 anomalies that are quite similar to one another. And in our projects, I will show you to the end, that we try to recognize that using by copying data points from other patients and other links, with good and bad results. So how does it actually look like in practice when we do this anomaly? Well, when we extract the data, we try to extract the data by and provide domain knowledge to that data. So for instance, here you see a diagram of the level of oxidation of the brain of a patient. And then we have a number which is annotated later on with different events that happen during the surgery. The most interesting event is, of course, this one. As you see, it is both as I said, its area of interest. That's actually the simulated stroke in a patient's status. And then, of course, we try to understand how different that kind of anomaly is from other type of data. So we could see when the patient is sedated, when the heart slows down and the amount of oxygen goes down in the brain. Then we see the period of the actual surgery, and then we have a period when the artery is closed, where there is a difference actually between left and right hand side of the brain, and then we see when the patient is out of surgery and even being woken up again after that. So we are looking at this kind of periods, and we are interested in this particular anomaly, how to recognize that. And that's, of course, if you look at this anomaly, that's not such a big, such a rare event. It's about 30 minutes of 6 to 8 hours, which is about 8 to 10%, give or take, of the entire operation. But if we look at, for instance, how this, how good the algorithms are at identifying this anomaly as anomaly. So when we apply this isolation forest to our full data set, and now the full data set is not just one signal, but it's 48 different type of signals. And if we apply this isolation forest and try to see if the isolation forest as an algorithm would provide us with some good result in identifying whether this stroke simulated environment is actually in effect, then we would see that we would like to see this purple dot and this box around it to be exactly the same. And as you see, they are not. There is a lot of purple dots grouped together, but the anomalous data points are all over the place. Sometimes it's an anomaly just when we provide the patient with medicine. Sometimes it's an anomaly when we actually have patients being woken up, and so on and so on. So this algorithm actually, again, just like with the computer-generated data from microwave links, even if the data is different, it doesn't really work that well, simply because it doesn't understand the domain so much. So if we look at this on the evaluation, well, the accuracy of the algorithm itself is very good. I'm sorry. So if we take this to the next level, then how about we don't look at anomaly as an anomaly, but how about if we look as an anomaly as a specific type of event? So instead of so we change the definition from defining it implicitly, we define it explicitly, and we actually look at different type of events. And we don't use the isolation forest, but a sister algorithm, random forest, which is not looking for outliers, but looking for commonalities. And then if we look at that, we actually get the accuracy, which is much, much higher. So it's almost a perfect match for that. So simply using exactly the same techniques, sister algorithms, but changing the definition a bit, we actually could get much, much, much better results. But then the question arises, well, to which extent we actually can, how rare those events could be, to which extent we can play around with definition and actually change that. And remember, as I told you, this anomaly was about 30 minutes out of 6 hours. So it's not that rare. It's still about 8% of all the data times. How about if we go down to 5% or even 1%? Would this algorithm really work? Well, to do that, we actually run this on the anomalies from the radio networks, because for the patient's data, we only have a specific number of hours that the patient is during the operations. But for the radio network data, we can have generated data for years or months, so it's quite many data points, and we can actually play around with that data much more than we can with the patient data. So if we go to the definition, for example, where we have rare event, this anomaly, to be only a few minutes during a month, and that's actually how this works. It's usually only a few minutes of rain that make any impact on the radio signal during the month. And then our data is much more uniform. And as you see over here, we can have different type of anomalies. We can have, for example, very strong wind. We can have sunny periods of time. We can have windy. We can have rainy, and we can have anomaly, which is basically an antenna getting dry again. So how does this work? Well, if we use this algorithms again, we look at this data on a much longer scale. So this one is about, as you see, about half a year, give or take. Then there is a lot of those anomalies. Some of those anomalies are typically not rain, like those large peaks. Those are usually caused by something else, but they are still much smaller, much fewer, much more seldom than all the other types of the data. So if we apply this algorithm, how does it look? Well, by changing the definition again and not looking at anomalies, but looking at the actual, so changing the definition, we get in much better confusion, much better results, much better confusion matrix. We actually, if we look at the definition, then if we plot those data sets, we could see that the green ones, this is a non-anomalous period, so a sunny period where the antennas are working as the way they are. Then we have a period of all the anomalies, and here we have two types of anomalies. The blue type of anomaly, that's a rainy weather, and the orange type of anomaly, that's a windy weather. How do we know that? Well, we know that because we can correlate this particular data with the weather forecast during that particular period in that particular region. So maybe not 100% correct, but close to 100%. And here's what you see. An interesting observation is that the non-anomalous and anomalous data points are spread far away from one another, but the anomalies within each other are essentially quite interchanged, so they are one among the others, so to say, which means that we are essentially very good at predicting certain class, whether there is no anomaly, so the green periods, but then the algorithm has quite hard time confusing the rainy and windy and rainy or windy periods of time, simply because those anomalies look very similar if you look at them from the perspective of the feature vectors that are represented by them. So, of course, one good idea would be to take a look at and try to balance those type of anomalies. For example, take data from another link that looks that has only data about, for example, wind, or only data about rain, and add this to this particular chart data set. And as you see here, then this picture becomes much better. So then we have anomaly, then we have non-anomalous, the green points, then we have one type of anomaly, rain, and then we have wind as a third type of anomaly. And the algorithm works really good. So the algorithm can actually distinguish three types of anomalies. And if we do the same with patients, we get very similar results. But by doing this, we are introducing a very important bias or confounding factor. Now, every patient and every link has certain type of characteristics that are individual to that person or to that link, which means that the algorithm essentially doesn't really learn anomaly in terms of wind or rain. It learns what type of link or what type of patient the algorithm is actually looking at. And that is something that we are working on at the moment when we are trying to equalize or take away the individual characteristics from the patients and individual characteristics of the data sets from the microWave links. But then by doing that, we also introducing another type of bias, which is changing the data. So by reducing the individual characteristics, maybe, and we don't know that yet, maybe we are reducing other types of features that are important for the algorithm that we don't deem as important. And that is something that we are working on at the moment. So to sum up, this is what we are working on with anomaly detection. We are very good in actually detecting anomalies. We are a bit less So in understanding what kind of anomaly this is, we are very good in trying to use patterns to detect those anomalies by rule rather than by contradiction. I think we established that in our work that this by contradiction doesn't really work, neither for the computer-generated data nor for the patient-generated data. And we also found that from our perspective, it's much better to define anomalies first, what we are looking for, define the patterns, rather than to look at the data, understand what's an anomalous data point, and then classify that anomaly. That we have found that it actually doesn't really work that well. And this work has been done, as I said, together with my colleagues from Sahlgrenska University Hospital and from Ericsson, that are part of the Chair Finance associated microHRV project. And with that, I thank you for listening, and I'll open up for questions.